Hi, I'm Dr. Omar Farooq. Today I'm going to talk about CVA, cerebrovascular accident known as stroke. An ischemic stroke happens when a clot in the brain artery blocks the flow of blood and oxygen inside the brain. When brain cells do not get the oxygen carrying blood that they need to function, they begin to die, and the damage could be permanent and leads to disabilities if timely action is not taken. The longer the brain cells are not getting blood and oxygen that they need, the greater the damage to the brain that can even cause death. An ischemic stroke is caused by the blood clot that forms either in an artery of the brain or in another part of the body and then travels through the bloodstream to the brain. The symptoms stroke causes will depend on which area of the brain is affected. Patient may have trouble speaking and or understanding, seeing, walking, or moving his limbs. Patient may have sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Let me show you the model of the brain. This is brain, and red line you see, these are the arteries going to the brain. And there's a blockage here. You can see this bluish area, and this can lead to a permanent damage into the brain when there's a blockage. I will show you the artery that is going to the brain. This is one of the main arteries that is going to the brain. You can see there's a big clot here. It can block completely this artery and cause stroke. Or this clot can dislodge and go into the brain and cause stroke. Stroke kills about 140,000 Americans each year. That is 1 out of every 20 deaths. Stroke is fifth leading cause of death for Americans, but the risk of having a stroke varies with race and ethnicity. Risk of having first stroke is nearly twice as high for blacks as for whites, and blacks has the highest rate of death due to stroke, although the stroke death rate has declined for decades among all races and ethnicity. Hispanic have increased in the death rate since 2013. Stroke is a leading cause of serious long-term disability. What are the risk factors for stroke? Stroke risk increases with age, but stroke can and do occur at any age. Risk factors include high blood pressure, high cholesterol, smoking, obesity, and diabetes. 1 in 3 US adults has at least one of these conditions or habits. Early action is important for stroke. Know the warning signs and symptoms of stroke so that you can act fast if you or someone you know might be having a stroke. Acting fast is key for stroke. Acting fast can help stroke patients get the treatment they desperately need. The stroke treatment that work best are available only if the stroke is recognized and diagnosed within 3 hours of first symptom. Stroke patient may not be eligible for these if they do not arrive at the hospital in time. If you think someone may be having stroke, act fast. Remember the word fast. F for face. Ask the person to smile. Does one side of the face droop? A for arms. Ask the person to raise both arms. Does one arm drift downward? S for speech. Ask the person to repeat a simple phrase. Is the speech slurred or strange? T for time. If you see any of these signs, call 911 right away and save a life. How to prevent stroke? Control your blood pressure and diabetes. Lower your cholesterol. Quit smoking. Watch your diet. Eat healthy and do exercise regularly. Thank you, and stay tuned for my next episode. Live healthy, live long.